Introduction to the HI test. The hemagglutination inhibition HI test is a rapid and economical serologic test commonly used to identify hemagglutinating viruses, such as orthomyxoviruses and paramyxoviruses. In the HI test, specific antibodies are used to inhibit the agglutination of erythrocytes by hemagglutinating viruses, hence the name hemagglutination inhibition test. The procedure that will be described is somewhat different from that described in the OIE Manual of Diagnostic Tests and Vaccines, but the test has been shown to produce equivalent results. Since most laboratories will not have reagents to identify avian influenza viruses, the procedure described here will be for identification of avian paramyxovirus type 1, or Newcastle disease virus. Begin by labeling U-bottom microtiter plates in rows of 8 wells for each unknown to be tested. Label an additional row to be used for a positive control. Add 25 microliters of the unknown virus sample, diluted to contain 16 hemagglutinating units per 50 microliters, which is equivalent to 8 hemagglutinating units per 25 microliters, to each of the 8 wells in the corresponding row. Also, add 25 microliters of diluted Newcastle disease virus to each well in the positive control row. Add 25 microliters of the standardized antiserum to the first well of each row. The standardized antiserum has been previously absorbed with erythrocytes to remove the natural agglutinants present in some serums. The antiserum is also diluted to achieve an endpoint titer of 1 to 32 or 1 to 64 with homologous antigen. With a single or multi-channel pipette set to deliver 25 microliters, make a twofold serial dilution of the antiserum in the antigen across the plate beginning in the first well and continuing through the 8th well. Discard the terminal 25 microliters from the 8th well. At this point, each well should contain 25 microliters. Cover the plate with a plate cover or empty plate and incubate plates in the biosafety cabinet for 30 minutes. Following the 30-minute incubation period, add 50 microliters of a 0.5% washed erythrocytes to all wells. Seal the plate with sealing tape and thoroughly mix to suspend the erythrocytes. Remove plates from the biosafety cabinet and incubate for 20 to 30 minutes at room temperature. The HI test should be read when the erythrocytes in the positive control and cell control wells form a distinct round button in the bottom of the well. To facilitate interpretation of the results, tilt the plate at a 45-degree angle until the erythrocytes in the positive control wells form a teardrop shape, usually about 20 to 30 seconds. Record wells where erythrocytes have formed a teardrop shape as inhibition, and wells where the erythrocytes do not teardrop as no inhibition. Specimens that do not form a teardrop but are partially inhibited are recorded as incomplete. Unknowns are identified as Newcastle disease virus if the endpoint of the unknown is within 2 dilutions of the endpoint of the positive control. Isolates not inhibited by Newcastle disease antiserum should be considered suspect for avian influenza and should be confirmed by other tests.